for his blood pressure for it goes to. He needs a
So
not
my
really
daughter
physical. He's had a physical about was it last year or a year before that, and they said they lost it. So I don't know if I need to redo another one.
Yeah, they require a physical.
Yeah, we'll just go ahead and do that today since we have the time frame for that.
Okay.
What pharmacy do you usually have medicine sent to? Walmart here in town, right?
Yes.
Okay.
Hey, guess what? I'm making a bill for you.
Okay. Any new allergies since the last visit?
No.
No.
Any changes in medicine since the last visit?
No.
No.
Been working.
And Cameron's how you been?
He's got to make a video of everybody at the same.
Okay.
I'm telling me bills at a doctor's office all the time.
And then that way you can listen to what the doctor has to say. So
Yes, it's a good idea.
You can follow up on it.
Yeah, no, Ben.
Alrighty. Gotta add some stuff to here because it cut it out for me, of course. Do you get a well-balanced diet, Willie?
Yeah.
Okay. How many servings of fruits and vegetables do you get each day?
Well, I mean, I used to eat some apples, some strawberries, and some blueberries or something.
Good. Good.
He tries making smoothies.
Good.
I try to make a homemade delicious fruit smoothie.
Awesome. And then how often do you eat out or take out from restaurants at all?
Good.
How often do we
How
eat out?
often?
I don't know why. I don't know.
Chance I get money.
I don't blame you on that one.
Yeah.
Eat out every day.
No, about every other day or something like that.
I know.
Maybe 3 days a week.
Yeah.
I know, Ben.
Do you exercise, Willie?
Yeah, I do.
Well, he don't exercise.
I do exercises on the wheel. Nintendo.
Exercise, he gets his bone in the yard. That's the thing.
I do exercises on the wheel. On the wheel.
At the farm.
On the wheel.
He's got a Wii Fitness balance board. And
Wii Fit Plus.
Use that.
Okay.
We fit you.
Yes. How many hours of sleep are you getting at night?
Good.
How many hours?
Maybe 10 days ago.
What time do you go to bed?
I used to go to bed at 11 o'clock, watch TV, play video games.
What time do you wake up?
Oh, I used to
He
wake
was
up.
up about 8 o'clock this morning.
Gotcha.
So.
So 8 to 9 hours.
Yeah.
Good.
Mm-hmm.
Good.
I went to bed 11, got out at 11. I was up watching Grey's Anatomy.
Do you wear a seatbelt in the car, Willie?
Yeah, I do.
Okay. All right. Do you have any concerns for your safety in your home?
No.
Nope. Good. Alrighty. Is it okay if I get some vital signs on you?
Uh-huh.
All right. I'm going to use this thing. That way I don't have to ask you guys to move or reach behind your head.
Okay, cool. That's nice. That's in the thing.
Hopefully technology and I are friends today.
Oh, yeah, I know. Okay. Alrighty.
I'm going to stick this on your arm.
Okay.
Are you a big fan of race cars?
Yeah, I do.
Do you watch NASCAR every week?
Uh-huh.
So Ross Chastain just won Sunday, right?
Yeah, I do like Chase Sonian.
You do ya?
Here we go.
Stick this on your finger.
Okay. Okay.
And then I'm going to scan your forehead to get your temperature.
Okay. Nice.
Temperature is 97.5. Blood pressure is 141/86. Pulse is 88.
Thanks so much.
I didn't take his oxygen for whatever reason, so I'm just going to use Old Reliable over here.
Okay.
He's not breathing right.
Apparently not at all, according to this thing.
We don't have those too.
All right, so it's 99, so that's perfectly normal.
Mm-hmm. Thanks so much. Tell her to print out one paper for me, right?
I will.
What's an abdominal EKG?
Abnormal or abdominal?
It just says on here had abdominal EKG.
Abnormal EKG.
Okay, no.
So that means an abnormal heart rate then.
Okay, no. It's not abnormal.
Not in that aspect anyway, right?
Right.
Just
No,
in the
it's
best
been-
ways.
Just in the best ways.
All right, Willie. I will let Dr. Dada know that you're ready, okay?
Okay, tell her that, I'm still making a video.
Okay, I will.
Alright, thank you.
Thanks so much.
Let me plug that in for us.
Okay.
I don't let the battery die.
Well, you never
Let her know I'm making a video.
Okay.
Thank you.
Thank you guys. It was nice meeting you.
That's me, guys. Thank you. I'll see you on Doctor soon in time.
I'll be here soon.
Let's go ahead and take a look in the thing. So in here we got this seat right there. And put your butt on the seat and just sit down sit down on your butt. Gloves, the sink, paper towels. Nice picture. Nice picture frame. You can connect your phone to your Wi-Fi. Here, I'll show you. Here, I'll show you.
He knows how, Lily.
I know how to do that. But I don't need to. It's okay.
Okay,
I
no.
have unlimited data.
Okay, cool.
It's the best thing to have sometimes.
You always connect your phone to your Wi-Fi. You go to settings and let's go down to Wi-Fi. If you want to.
What other sports do you like to play besides bowling?
Maybe soccer game.
You have no that you want to do yourself, not on a
Oh.
video game.
I
Hey!
left my thermometer in here. I don't know where I put it if I did.
I don't know.
I'll see.
I know you didn't stick it up his butt.
Oh, it's right here. Alright, the Dr. Dada will be in shortly.
I
Thank
thank you.
Right. So sorry. That's the ear pressure right there. Core thing. What is up in this camera? There we go. So if the temperature and the scene.
I don't know if I filled this out or does the doctor fill this out? I don't know.
The dollar fills is out.
He fills.
So I can.
No.
I have a list of medications. The doctor fills this part out.
It fills out. Those are more waterproof and football too thing.
Those are not waterproof.
It's not?
He thinks those are
The
waterproof.
Crocs?
Yeah, cross. I got any cross at Walmart one time ago.
They get slippery in water.
Yeah.
Might fall in your butt.
Yeah.
Probably wear them in the pool. You can get it cleaned out.
Yeah, I know. Where I
It's been
wear
so
them.
daggone raining, you can't do nothing.
Oh, hi!
Hello. How's it going?
How you doing, man?
Good, how are you?
Good, and you?
Good.
How you doing?
Good, how are you doing?
Good, and you?
I'm good.
I'm making a video, man.
Sure. So what's going on?
When we went to his psychologist, the doctor was wanting, she was worried about his blood pressure. It was a little high at the time of his visit.
Uh-huh.
That was like a couple months ago, I believe it was.
Okay.
And we couldn't get in until now.
Okay.
To
Anything else?
discuss. And also too, we need a physical for his Special Olympics bowling.
Sure. Okay.
I got the paperwork right here. I think
Yeah.
I got it all filled out. So.
Yeah. Okay. I'll do that. Okay.
Okay.
All right. And then so, how long's the blood pressure been up for?
I don't think it's up now, is it? What was
A
it?
little bit.
A
What bit?
Yeah.
How long's this thing been going on for? Is it?
How about a couple months?
Okay.
Come on.
Yeah.
Do you check it at home at all?
I got a blood pressure machine at home, but I had it, but I can't find it, so I might have to get a new one.
Yeah. So I mean, so normals depends on who you follow. But there's, the least strict group will say 150 over 90.
Mhm.
So if you're at 151, it's high, and if you're at 91, it's high.
Yeah.
I go with a little bit less than that, so I go
Yeah,
with
no.
145/85.
Okay.
Okay.
So you're at 141, which is normal, higher end
Okay.
of normal, but still considered normal. Second number is 86, so you're like a point above normal. You
Okay.
know, I wouldn't like.
So you don't think he needs any medication?
Yeah, like
right now?
like the doctor opinion is yes, you're at 86, yes, but like I wouldn't start it for me or my patients. Like I usually
Right.
don't do that. They say
Same thing.
there's a few sometimes it just goes up. There's tons of reasons why it could be higher here than it would be at home.
Somewhere else.
Yeah,
Yeah.
and if you're here, for 30 minutes every 6 months, like does that really matter? Not
Yeah.
really. You're at home way
I
more.
know
or
I
whatever.
have high blood pressure.
Yeah, so what I tell patients in this situation is just check it at home once or twice a day. Write it down because sometimes patients won't write it down and it's hard to
Okay.
remember. If you write it down for like let's say 2 weeks, twice a day, you have 30 numbers. Then you can get a better idea. Okay, is it
Yeah.
actually high? Is this a one-time off reading? You know what I mean? If it's high at home,
Excuse me.
if over the next 15 days, 30 checks,
Mhm.
you have 25 are high and 5 are normal. Well, you probably
Right.
have high blood pressure, but if it's 25 are normal and 5 are high, well then you don't really need meds. You know what I mean? So
Yeah.
I'd say for now,
I mean, he takes 4 medications now.
yeah,
I mean, I don't like him taking a lot of medicine.
Yeah,
That's
exactly,
not
yeah.
necessary. So
Yeah.
I take a lot of I take a few myself. So
yeah. Again, if this is his actual blood pressure, I still would tell you could probably just do like diet and exercise, cut out some salt, and it would go down. But my guess is probably a little bit better at home than it is here. So
Yeah.
anyway, I would check it at home and we'll see. If it's, I don't want to tell you what to do yet because if it's normal
Right.
at home, well then don't change anything. But if it's high at
Right.
home, we could probably, if it's really high at home, then yeah, we start meds. If it's kind of borderline, we say diet and exercise, decrease salts, exercise a little bit more, decrease fatty foods,
I know.
so it'll come down. And
hear that? No more eating out.
and
No.
if it's normal at home, then do what you're doing.
Yeah.
What's the with that, Mom?
We will.
All right, so that's the blood pressure. What else?
Nothing else. I mean, he, like I said, he goes to the Urbana clinic for the psychologist.
They have them on they're managing the risperidone, the
Risperdal.
Vyvanse, and then the hydroxyzine. I'm guessing
Yeah, and he
Okay.
also takes something for his stomach too.
lactulose.
Yeah, and
Okay.
he does have problems with his stomach every now and then.
Yeah. I do take some tummy medicine.
Yeah,
Okay,
he
does it
calls
help him go?
It lasts for like a week or two,
Uh-huh.
sometimes depending on how much he eats.
Okay.
And I'm trying to get him away from, he likes a certain amount of candy,
Uh-huh.
and I'm trying to take him away from the candy.
Mhm.
He said, I don't care if he eats a piece or two, but you don't need to sit there and eat the whole bag, and then he complains that my belly hurts.
Yeah.
And he had a tendency of eating a bag of bubble gum that you get from Dollar Tree for $1, and he'll eat the whole bag.
Yeah. That'll probably cause some stomach pains.
Oh yeah.
Yeah, I know, Ben.
Then I got to say, oh, my tummy hurts, and
You have the
Then it
history
starts
of
beating on the wall.
endocrisis, making sure you're drinking more water, those sorts of things.
and I try,
Yeah, exactly.
and I
And
try to
so
make him drink more
You want
water.
to do
Water.
water, fiber, and it doesn't have to be just water. I mean, you could do water is better, but you could do
What about
sports
Gatorade?
drink. Yeah, sure.
Mhm.
Does it have to be a Gatorade sports drink or just straight out Gatorade?
What's the regular Gatorade?
I don't know. There's regular Gatorade and there's
There's all
Gatorade
kinds of
zero.
Yeah,
I
I think
think-
zero has less sugar.
Yeah, I think any of them are fine. Yeah, if you're gonna go less sugar, is always gonna be a little bit better. But really, any of them, and it doesn't have to be Gatorade. Any of the problem with just water by itself is you're not replacing the electrolytes
Right.
that you're losing.
Yeah.
So
Get your hand out of your pants.
That's all I'm sorry, Aim.
Okay.
so with everything else, you're also
You're
getting
fine,
rid of
Mom.
electrolytes.
Okay.
And so when you're replacing it with just water,
Water.
like you're not getting
Fine,
those
Mom.
electrolytes
Like those
back.
little flavor packets. Is that
Well,
okay?
but you mean that, or again, Gatorade, Powerade, Body Armor,
Yeah.
all these sports
All these
drinks
things.
have the electrolytes in them
So,
too.
Okay.
So
That will help with the weight management, probably, or not? Not
the
really.
weight part, no.
No.
But it'll keep the electrolytes up, no.
Okay.
The weight's gonna be diet and exercise.
Yeah.
The exercise is the hard part for most patients.
I know. I hate exercising myself, so you know.
Okay. So you're younger than most of the wellness stuff that we do. A lot of it starts in like the mid-40s. So, we don't really need to worry about it a lot, but we'll just go over it really quick. Like prostate cancer screening, we don't do until 50s unless there's like a young age, like a family history of a young age that you know.
Yeah.
So I'm guessing no.
No.
That he doesn't need to be tested for it. Any drug use?
Oh yeah, no.
No.
Alcohol use?
No.
No thing.
Tobacco use?
No.
No.
So those are honestly three of the main things that we do at this age. And then obviously minimizing exposure to sun, because skin cancer, so you want to use sunscreen if you can,
Right.
or avoid it to be the shade.
See?
Osteoporosis we don't start checking until a lot later in life. Smoking, like lung cancer screening we do later in life. Any reason to check for TB, I'm guessing it's not a high risk. Okay, not around anyone that is high risk. Any intimate partner violence or anything like that we need to worry about? No, okay.
Well, he gets violent with me.
Okay.
Yeah. So.
But no one's getting violent with him.
No.
Okay. Then blood pressure we talked about.
Cards and
I've had to call the cops on him a couple times,
Oh, wow.
but yeah. So yeah.
we don't worry about calling something.
Yeah. Well, then you better behave.
Yeah, I am one thing.
Okay.
Is that before the medicine or after?
Before.
Okay. So he's doing better now.
Yeah.
Again, colon cancer screening we don't start until 40s unless there's a family history at a young age that you know of.
Not that I know of.
Okay,
My
we go 10
family.
years before the youngest family member or 40.
Yeah.
Any reason to check for HIV, hepatitis,
No.
chlamydia, nothing like that? I'm not sure about this.
No, that
Breast
then.
cancer screening we're not sure about. Then anxiety and depression, he's already on meds for it, so. Yeah, so honestly that's all of the screening stuff.
Yeah.
Really, it's just, there's a lot that we don't really need to do at the same. Do you guys want to do blood work, for cholesterol, diabetes,
No,
that
thanks.
stuff, or no?
He don't like needles.
Okay, that's fine. Technically, at this age, you're based on BMI. I guess it would be okay to do, but really, we don't need to do it until you're
Yeah.
in the 40s.
Don't even do it now.
We still do it for a lot of patients, but
Dr.
it's
Young was wanting some blood work done.
No,
We've been asking for years for him to do it, and he won't do it.
okay.
I won't do it now.
Yeah, he
Okay,
won't do it.
that's fine.
So
I mean, I guess if anything comes up, then we'll look at
Oh,
it
yeah.
first. Okay. All right. Anything else?
just the physical.
The phone.
Is there just a part I have to sign, or
Huh?
is there stuff I have to fill out, or just sign?
Yeah, next page. I think there's another page.
Is that your pen?
Yes.
I can grab one from us if you want.
No, that's fine.
Yeah.
Has he ever had loss of consciousness?
No.
No.
I think this part's for you too.
Oh, okay. I didn't know.
Yeah.
I think the next page and page
Yeah.
after that.
Yeah. This is medical history stuff. Alright. Oh, it's detailed. Okay.
Excuse me.
He's played before, right?
Yes.
There's no reason why
Yes.
he wasn't able to play.
No,
I'll just ask
they
you.
just do it every year.
All right. Headaches when exercising.
Do you have headaches when you exercise, Willie?
Well, I mean, I used to get a headache sometime.
Used to,
But
not,
Yes, you-
not from exercising though. Just
not
in
from
general.
exercising.
How
Yeah.
about dizziness when
No.
you exercise? Chest pain when you exercise?
No.
Difficulty breathing when you exercise?
You know.
Feel like your heart's skipping a beat?
Yeah, I probably don't know. We fit you.
He gets on the Wii Fit You.
And he's able to do it without any problems?
Yeah, he's
Okay.
fine.
Any history of heart murmurs or heart disease or heart
No.
attack?
No.
Anything, high blood pressure. I'm gonna put no because it's not really high yet. We haven't confirmed it.
Okay.
Cholesterol, no. Visual issues? Yes.
He had eye surgery when he was 3 because the veins, when he was born, they were in the wrong place.
Always.
My vision's good now?
Yeah.
Okay.
Last time I was having surgery on my body one time ago, man.
Okay. No sickle cell or bleeding issues that you know of? Okay. No asthma?
No.
Concussions, strokes? Diabetes, hepatitis, no. Arthritis that you guys know of, broken bones recently or dislocated?
No.
Okay.
He hasn't had any broken bones.
No, I haven't.
Maybe controlling bowels or bladder? No. That's more for loss of control. So his is the opposite problem. Too much. Numbness, tingling, I'm guessing no. Weakness on arms, legs, or feet, my guess is no. Any burns recently?
No.
No.
His head turned, no. Paralysis, no. Epilepsy or seizures?
No.
No.
Any aggression in the last year?
Yes.
Yes.
And then anxiety and depression is diagnosed, yes. Hurt himself at all?
No.
No.
Okay. Can he take his medicine on his own?
Mhm.
Yeah. Yes, you can.
Alright, I'm gonna let you just fill out this one part about describing the mental health things right there, and
Okay.
then the medicine. I'll do this part real quick. Alright. How are your teeth?
Good.
Yeah, smile. Okay. The bottom ones? Is that the bottom teeth?
The bottom teeth.
Can you put your lip down?
Pull your lip down.
Your lip. Sorry.
Oh, wait.
Let him look at your mouth. There.
Oh, you're good. Okay, you're good.
Good. Okay, come on.
You're welcome. My sister was a dental hygienist. A long time ago. She don't do it anymore.
Yeah, no, it's don't do it anymore. Oops. Okay.
Alright. Willie.
Well, I don't want
Now,
to.
give me the tablet.
Oh.
He does the gram.
Here, I mean, I'll set my camera now and then
Okay.
thing.
Am I going on YouTube?
Yep, I like YouTube. I have YouTube thing.
I'll listen to your heart and lungs, okay?
Okay.
You just breathe regular.
Mhm.
No, regular. Couple deep breaths. One more.
Good.
I'll look in your mouth first. Look in your mouth. Stick your tongue out. Okay. Alright. Alright, so you got some earwax, but nothing crazy. Do you clean your ears out at all?
Yeah, clean yours all the time.
What do you do?
No.
No.
He won't do it. I gotta do it for him.
How often do you do it?
Oh, about every month or so.
I would use Deverox, like at least twice a week. The peroxide spray.
Alright.
Yeah, I go with that at least like once or twice a week. It's pretty easy. I mean,
Okay.
I use. I'm not supposed to recommend Q-tips because you can
Yeah.
jam the wax in. Like for him right now, Q-tip would be bad because it would just push it in.
Yeah.
But if you use a Deverox, it dissolves it.
Okay.
Yep.
Alright.
Pretty easy to do.
Go ahead. Yeah, man. I mean, did you see what happened to my toe?
Your toe's fine.
Yeah, no.
Okay.
My toe's getting better.
You don't have any limp or anything, right? I didn't notice any limp.
No, no.
No.
You said your vision was normal.
Yes.
Yes. Excuse me. Excuse me again. Yeah. I hate people giving my data for free.
Really?
Yeah, Ben, I mean, I don't want people giving my data for free.
Well, quit giving out your email, then they won't use your data.
Mm-hmm.
Told him this, I don't know how many times, but he don't listen.
I used to listen more, I know.
I know.
I will listen.
Okay.
Don't want to give out your personal information.
That's right.
Yeah, I know, Ben. Excuse me. Spend one time, that way. That's so nice.
Okay, so he's clear. So I think I don't even need to do this page.
Okay.
Saying if I only need to do it if you're not cleared, but
Right.
you're cleared, so we're good.
Okay.
Good, come. Same time.
Huh?
No more this time.
What was that?
No.
Are you good at bowling?
Uh-huh.
What's your average?
Oh, no.
Does this hurt at all?
Let me see. Let me give him. Yeah, it does hurt. Same thing.
Where does it hurt?
There.
So that hurts?
No.
Okay.
But my diary poop is better.
Huh?
His diarrhea poop is better.
Okay. Okay, good.
Hey, listen to your belly.
Okay.
Alright, just relax your leg.
Okay.
Relax.
Okay. Good. Okay. Thank you, man.
Okay, you're good. I'm gonna make a copy of this for our
Okay.
records and then that's good to go. Just give us a couple minutes.
Okay, I mean,
How often were you seeing the doctor?
For the psychologist?
No, here.
Oh, every now and then.
Okay. Like, so do you want to do a year?
Yeah.
Okay. Oh, if the blood pressure's high at home, then we'll make it sooner.
Okay.
My guess is it's gonna be better at home.
Okay.
So again, if it's high at home, just let us know. Again, 145, 85 is what I go with.
Okay.
If it's high at home, you can let us know, and then we'll. Again, we don't necessarily have to add meds right away, but we should. Like, if it's high in 2 weeks, I'll have you check with him doing diet and exercise and see if it comes down. If it like gets worse or something, then we need to see you in person and talk about it. But
Alright.
I guess it's gonna be better.
You also
Can I have a
have
pen?
Oh yeah, sorry.
okay.
I'm
Hey, man.
prescriptions for Depends.
Oh yeah, I'll send those in too.
Yeah.
Do you know what size?
Don't forget my
Extra
paper
large.
printout.
Okay,
Extra large.
extra large. Okay, all right, give us a minute.
Thank you, man. Man, I did a good job with one of my doctors.
That's the first time I met him.
Mm-hmm.
You did a good job.
Yep.
Nice.
I care about.
No, my luck.
See, Mom.
I got the Mitsubishi keys. I bet I left them in the car. I'm good at doing that. Yeah.
Rubble with everything.
I left them in the car because I was in a hurry.
Nice.
Now we gotta go home and fix supper.
Mm-hmm.
It's getting late.
Mm-hmm.
About supper time. It's 4:20.
I know,
Go home and see what Tom wants. He's off tonight.
Who's that?
My other son.
Okay.
Yeah.
Where does
He-
work
He works at Amazon.
at? Okay.
He works third shift. He works 6 o'clock until 5
Oh, wow.
a.m.
Yep.
Yeah.
It's a long day.
All day.
He works 12-hour shifts.
You gonna get a job out there, brother?
Uh-huh. Yes, I have been.
That'd be a cold day, you know. He gonna do that.
Oh, Mom. Mm.
Tom don't need him out there driving him nuts.
Yeah.
I know. Oh, Mom.
Oh goodness. Mom's got to go pee again.
Uh-huh. I know.
Alright, turn the video off.
No, I'm a big one. Don't tell me. Yeah, Ben, I mean, I laugh and cry all the time.
It happens. It's good to be emotional, but you gotta keep it in check.
Yeah,
Uh-huh.
but I get in trouble if I cry.
I make me laugh and make me cry.
If I start crying, he'll get mad at me because I start crying. What are you crying for? Like, I'm not allowed to express my emotions.
Oh my goodness, Mom. Oh
I'm
my.
not allowed to get mad. Don't get mad. Wait a minute,
Don't be mad all day, Mom.
well, stage you piss me off.
Yeah. I'm not pissed you all the time, Mom.
Sometimes it's every day.
I know, girl.
It happens.
I know.
Well, you stay in here, Ben. I gotta go use the bathroom.
Come,
I'm right back.
come.
They'll probably come back as soon as they get ready to come back.
Yep, sure.
Dun. Da, 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 da. Am I going, Mom?
I beat him.
Oh, yeah, it did. Oh, shit, Mom. No seen the
You
film.
got more things to do today?
Yeah, I need to go back to the office. Got some things I need to do.
How's April doing?
She's doing good. She's
Is
busy. We had her accreditation.
What's she doing
last week.
now?
She's our lead SSA, so she's helping people when they come in training.
Oh.
Okay, come on in.
All right, got some
Dang.
stuff here for you.
Alrighty.
As promised, 2 copies of this prescription.
Uh-huh.
Steal this one.
Yes.
Yeah.
Do that.
And
Thank you
then
so much.
paperwork back for you.
This one.
And then Dr. Dada said that you guys are good to go. He
Okay.
just wants you to follow up in a year, so you can schedule that today, or
Okay.
you can call and schedule that closer to the 1 year
Oh
mark.
yeah, we'll do that
Yeah.
later.
Whatever works best. Most
Okay.
people don't know what they're doing a year from now, anyway.
You never know.
Exactly. All right.
Alright, thank you.
Thank you so much.
You can head out that way and then.
Alrighty.
Nice
Thank you.
meeting you guys.
Nice meeting, guys. You too. Thank you. Have a good day.
You too.
Okay, we'll see you later.
See you, guys. Ben, it's so good to see you.
Nice to see you, bud.
I'll see you next time.
Yep, I'm glad that your appointment went good.
Yeah, I know it did. So yeah, the thanks for watching, and now we never go to Facebook and my Twitter. That's what we wise. Far around. That's what I say. Bye, Ben.